face the issue, I guess, of health care. I was reading the other day that both Governor Romney, who of course had passed a certain type of health care plan in Massachusetts, and President Obama, who led one through a couple of years ago, both have very few comments in their speeches about their health care programs, but they have to answer a ton of questions about them. So anyway, in light of that, I'd like to ask the Democrats, do you think that the President's health care bill was a good step forward to help the people without health care, or was it a step towards social?
First, I'd like to start off by why this bill is important and some things you guys may not realize. Under the current system, half of all Americans under 65 will lose their health coverage at some point over the next 10 years. In the last 12 months, 6 million more Americans will lose their health insurance. Harvard researchers found that 62% of all U.S. personal bankruptcies were caused by health problems. Also, 1/3 of all healthcare spending is either unnecessary or harmful. I kind of want to break this legislation down for you. It's the Patient Protection and Affordable Care Act, what people call Obamacare. That's its proper name. And these are just some of the things, and you listen to them and tell me if these sound like such dreadful, horrible, socialistic things. Coverage for children up to the age of 26 on the parents' policy. Elimination of pre-existing conditions for children, which means before this took place, if a child was born with a pre-existing condition like cancer, something they cannot help, something not brought on by themselves, such as smoking a cigarette, getting lung cancer, they were not covered by health insurance. This bill also ensures that insurance companies will be banned from dropping coverage because of an illness, imposing yearly and lifetime caps on coverage. So that means if you get cancer and you happen to hit your cap, they can drop you. You can no longer get health insurance to prevent that. Also provided small business tax credits for businesses smaller than 25 employees. Also requires to provide preventative care for proven preventative services, such as yearly checkup. If you go in for your yearly checkup now, you don't have to pay a copay, which some people may have not gone to their yearly checkup because they don't have the money for the copay. But this increases their likelihood of going and actually getting preventative care and catching something early. And to me, it's all about a competitive market. It's just like car insurance. Car insurance, it's illegal not to have car insurance. So when they made it illegal that you couldn't not have car insurance, that made the market go down dramatically, and it made it more of a competitive market. Also, I like to state that in this bill, you do have to have some kind of health insurance, and you can, I don't want to get into the details because it'll take too long, but there is a structure within the bill that goes along with that. It's a very gradual thing, but you still have the option to do private health care if you so choose, and hopefully that would require them to be more competitive so that it decreases the prices of your health insurance. Also, another perspective too is that currently if you walk into a hospital and you have a gunshot wound, you have to get treated. If you are in need of a service, you have to get treated. That costs taxpayers money. If everyone is required to have some form of health insurance, the bottom of the line even, that's going to help prevent some of that money being taken away from taxpayers because they will have health insurance, just like if you hit a car. They're required to have insurance, so that will pay for that.
Republican perspective on health care.
Well, first off, to answer the question,